In this video, we are talking about pheochromocytoma. So pheochromocytoma is a tumor of the adrenal medulla composed of chromaffin cells. It is malignant, often single, like most of us here, and secretes catecholamines such as epinephrine and norepinephrine. What causes pheochromocytoma? Well, they're mostly idiopathic, so we don't really know, but they are linked with rare genetic conditions such as multiple endocrine neoplasias 2A and 2B, and von Hippel-Lindau syndrome, which you probably wouldn't hear or read about too much. An easy way to remember some of the key features of pheochromocytoma is by the rule of tens.
10% are familial, 10% malignant, 10% multiple, 10% bilateral, 10% seen in children, and 10% extra-adrenal.
Let's go back into the depths of the adrenal gland, where we have already discussed the zona glomerulosa, fasciculata, and reticularis. Now we'll focus on the adrenal medulla, which secretes epinephrine and norepinephrine, our catecholamines. Let's talk about the functions of these catecholamines. They act on alpha-1 receptors present in the blood vessels to cause vasoconstriction. They also act on beta-1 receptors present in the heart to make it pump faster, increasing the heart rate, and harder, increasing the stroke volume, leading to an increase in cardiac output. They also act on beta-2 receptors present on the smooth muscles of the airway, causing smooth muscle relaxation. What are the signs and symptoms of pheochromocytoma? We can form a triad of the most common symptoms, which include episodic headache, palpitations, and sweating.
A characteristic feature of pheochromocytoma is the paroxysmal nature of symptoms, which means that the symptoms come and go in waves. This is due to the fact that the tumor itself secretes catecholamines in waves. So let's just draw some waves here to help us remember that.
Other symptoms include polydipsia, polyuria, weight loss, and postural hypotension. Some of these symptoms can also be triggered by stress, physical exercise, or particular foods such as cheese and wine. How do we diagnose pheochromocytoma? Initial tests include catecholamine or metanephrine levels in a 24-hour urine sample. Metanephrines are breakdown products of catecholamines and can therefore be used as a measure of catecholamines here. Plasma metanephrines can also be measured. If the levels of these two hormones come out to be more than twice the upper limit of their normal range, a CT or MRI scan of the abdomen is advised to locate the tumor. How do we treat pheochromocytoma? The definitive treatment is surgery, but it requires pre-medication with alpha blockers such as phenoxybenzamine followed by beta blockers such as propranolol. It's really important to give alpha blockers first. Otherwise, giving a beta blocker would first inhibit the beta-1 and beta-2 receptors, which would cause unopposed alpha-1 stimulation, causing vasoconstriction, leading to hypertension. So after medications, we have the option of surgical excision,
which is curative in more than 90% of benign cases of pheochromocytoma.
And finally, alternative therapies such as metyrosine are also available.
Let's finish this video with something to think about. A patient comes in with similar symptoms and is revealed to have a urinary catecholamine level indicative of pheochromocytoma, but the MRI scan does not reveal a tumor in the adrenal gland. Why? That's because catecholamine-producing tumors can also develop in the sympathetic ganglia present alongside the aortic bifurcation.
That's it for this video, and I'll cover some more topics on endocrinology in the coming weeks. So see you next time.